men telling women how to look, but the face of plastic surgery is absolutely changing. And Dr. Howland from Howland Plastic Surgery joins us now to explain why he feels so strongly about this. And I love that you're here today to talk about this. Thank you.
No, thank you for having me. So I originally was going to come on, and I had this. So I'm newly board certified. I've been in practice in Utah for about 2 years, and I was super excited to come talk about the importance of finding a board certified plastic surgeon, which I think is so important. But there's something that I think is even more vital that we talk about today. I think that there's this split in how the world thinks about plastic surgery. So to illustrate, so my cute mom, she's here watching today, and I can just imagine her. She's at lunch with her friends, she's super proud, and she wants to say, oh, my son, he's a plastic surgeon. But you know, he does some of the tummy tuck stuff and the breast augmentation stuff, but he also does some good plastic surgery. He helps with burn reconstruction, and he helps go on mission trips, and he helps with hand surgery.
She has to justify it.
Exactly, so there's this split, like the good side and then the vain, worldly side of plastic surgery.
And you're here saying you want to bridge that.
I don't see it that way.
Yeah.
You know, we're in this Me Too era and this age of equality, and plastic surgery, as you said, is this business of men telling women how they need to look. And that needs to stop. That's not how plastic surgery should be. And I think plastic surgeons are in part at fault. I mean, in this age, we're decades behind what the marketing should be. The trends in plastic surgery are for more natural, less fake, so smaller implants. Women are just getting lifts. Women are getting their implants removed. They don't want to look like things have been done. And yet we're still using this old adage of sex sells, and we're using these horribly sexist marketing campaigns as plastic surgeons. And I think that contributes to the way that the world sees plastic surgery.
So tell us how you are hoping to change that.
Well, I try and change that with my own patients, number one. So in consultations with me, it's not about making you look better. It's about helping you feel better about yourself. Because if you can feel better about you, then that's not about following a social norm, and that's not vanity. That is empowerment. And that's how I want all of my patients to feel.
So I actually requested to be in this segment when I found out what you were going to be talking about, because I feel strongly about this. I've had experiences where I wanted fuller lips, not because other people had fuller lips, not because my husband wanted me to have fuller lips, because I'll tell you, he wanted me to just stay the same, but I wanted it. I feel like so many times we have this culture saying, you're getting plastic surgery because you're being fat shamed, you're being shamed, you think you need to look better,
right?
But really, I was nervous to get it because I thought the other way that people were going to say, oh, why did you get it? Why did you feel like you needed to do that? Now she's fake. I was nervous that I was going to get judged for getting it. Not judged for not having it, but judged for getting that.
I love, though, that Dr. Howland, you sit down with your patients on that first time that you ever meet them and say, how can I help you feel happier in your own skin?
Oh, right? Patients come in all the time, and they'll sit down and they'll say, and it's women, it's men, it's transgender, it's everybody under the sun, and they'll sit down and they'll say, what do I need to do? What should I do to myself? And I tell them, you're in the wrong place. That's not what we do. You tell me what you don't like, and then plastic surgery to me is like any other technology. And if we're using it for good, it can be used really for good, but it's been marketed in a lot of ways for bad, and people are using it for bad, and I think it's getting this bad rap because of that.
Now, you're a little bit unique compared to some of the other plastic surgeons in the area because you have privileges at 8 hospitals. What exactly does that mean?
So I take call at about 8 different hospitals around the valley, so I'm very busy. And my practice itself is a good mix, so I do about 60% of cosmetic plastic surgery, which is kind of head to toe, facelifts, rhinoplasties, breast augmentations, tummy tucks, all of that. And then on call, I see a lot of hand trauma and a lot of facial trauma and everything else that can be plastic surgery related. And I really like the mix. It keeps me busy, but it's a good mix to just do a little bit of everything.
So if someone is out there and they're thinking, this is something I've wanted for me for a long time, this is the doctor I want to have, how can they get in touch with you?
Oh, anytime, just you can call my office. You can go to my Instagram handle, which is Howland Plastic Surgery. One of the things that we've been doing is I'm susceptible to this marketing, and I want people to change. I want plastic surgeons to change the way that they market. So I've gone back and I'm changing anything that I feel is sexist or is not in line with this message of equality. If you follow me on Instagram, I answer all of the direct messages myself, and we can get in touch with you can get in touch with me that way the easiest.
So how has your mind kind of changed about this? We obviously know that Isabel's your daughter, who was just in the thing. As a father to a daughter, how does that affect how you view plastic surgery?
I need to explain it to her, you know, and she comes into my office and there's breast implants in my office and there's pre and post-op pictures in my office, and she wants to know why women are doing this. And it was early on that I felt like I better be able to explain that to her so that she grows up to be the woman that I want her to be. And if that's somebody who, you know, feels a little bit better after some plastic surgery, that's okay. That's not a bad thing.
Yeah, let her support.
It's
Well, you're doing a
beautifully
great
said.
job. Thank you so much for being here,
We
Dr.
sat down
Howland.
and I said to Dr. Howland, that was a tough act to follow.
Yeah.
I don't know like where this is going or how you're going to be able to top that, but gosh, I think that was wonderful. So thank you.
Thank you.
Appreciate
Thanks
it.
for being here. Well, up next, how one credit union is helping you break free from high interest rates.